to Simply Women's Health with CJ. Today we're going to follow up on a previous video where we discussed abnormal uterine bleeding and the initial workup. So today I want to talk about the treatment options that are available given the different diagnoses for abnormal uterine bleeding. Again, we're not going to talk about pathophysiology, just about what to discuss with your patients when they present to your clinic. So the four primary areas of abnormal bleeding that we hit on in the previous video: heavy bleeding, amenorrhea, dysmenorrhea, as well as postmenopausal bleeding. We're going to I want to take each one of those and talk about treatment options associated with each one. So obviously it's going to depend on what your diagnostics showed. Does the patient have a pelvic ultrasound which shows fibroids? Does she have polyps? Does she have an endocrine issue such as hypothyroidism? Does she have a pituitary gland issue? That's all going to weigh into how you're going to manage your patient care. So for each individual patient, you want to look at what are their fertility plans and how do they feel about using different medications. A lot of patients are very hesitant to use hormonal medications. So we do have other options for them. Some women want to just cut to the chase and have surgery. That's not something that I'm going to discuss on these videos. That is something that the patient really does need to talk to a gynecologist about if she wants to do a definitive management such as an endometrial ablation or hysterectomy. That's up to the gynecologist to discuss with her. So as a provider, your patient has come in, you have done her diagnosis, you've done her lab work, you've gotten the appropriate pelvic ultrasounds. Your patient has heavy menstrual cycles. So there's a couple different, as long as she is not anemic, there is no, it's not a crisis at this point. So I usually tell them, you have a couple of different choices. You can do nothing at all. I kind of just make a little joking comment that nobody's ever died from a menstrual cycle, and so if you want to just keep bleeding and tracking your menstrual cycles, you most certainly can. If you want to do a medical management, you can do NSAIDs. Sometimes that can help calm the bleeding down. There are medications that work on clotting factors, TXA, that some people choose to use to help manage their heavy bleeding. The best one of all is going to be hormonal management with hormonal birth control, whether it's combined contraceptives that give a scheduled menstrual cycle that can be shorter, lighter, definitely more predictable, and can also have the fringe benefit of protecting patients from pregnancy if that is their desire. For the patients that say, I can't remember to take a pill every day, I am not a good candidate, she's got high blood pressure, her mom had breast cancer, she really doesn't want to use estrogen, the progesterone-only products, the IUD, the subdermal implant, the injection, those can also really help make that bleeding a little bit less, a little bit more tolerable. For the patient who has amenorrhea, she hasn't had a menstrual cycle in 3 months, and she's not pregnant. You haven't found anything wrong with her pituitary gland, her thyroid, anything like that. So those patients, if they do not desire pregnancy, I'll usually start them on a birth control pill, just so we induce a menstrual cycle on a monthly basis. For those patients who do desire fertility and who don't want to be on a birth control, on a hormonal birth control product, I will usually recommend that they track their cycles and be very diligent about it. I usually recommend if the patient goes more than 3 months without a menstrual cycle, first thing we do is we get a pregnancy test to make sure that the patient is not pregnant. And if they are not, I will usually recommend a withdrawal bleed with a product such as Provera. I give a 10-day course of Provera and induce a withdrawal bleed, just so we protect that uterine lining from overdevelopment. Like I said, endometrial hyperplasia is a thing. For patients who have dysmenorrhea, painful menstrual cycles, if they want to just manage their menstrual cycles, they can use an NSAID or products such as Celebrex. That one works really well for for cramping pain. If they want to just do heat, if they want to increase their exercise, if they want to do stress management, yoga, those kind of things, sometimes those can really come in handy for decreasing the pain of a menstrual cycle. Of course, if you want to protect yourself from pregnancy, if the patient wants to protect themselves from pregnancy, they can use birth control, which will make the periods shorter, lighter, and ideally a little less painful than they have been. As far as postmenopausal bleeding, you have done your ultrasound, you have done your endometrial biopsy, everything has come back absolutely fine. Those patients, they can either take a wait and see approach, see if it was just a one-off situation where they just had a little bit of abnormal bleeding. If everything comes back fine and they are complaining of vaginal dryness and you didn't see any cancer cells on the endometrial biopsy, you can consider giving them some topical estrogen, like an estrogen, vaginal estrogen cream that can help replump up those cells within the vaginal canal and maybe make things a little bit more comfortable for them, especially if they're having a lot of dryness and pain during intercourse. For those patients that if their cells come back abnormal, definitely want to refer them to a gynecologist, and the GYN can take over from there, whether they do a D&C or they do a withdrawal bleed. That is something that the gynecologist can certainly discuss with their patients. So if this has been at all helpful for you as a clinician, and you feel compelled to like, comment, or even subscribe to this channel, I would love that. If you feel as though this content might help your peers, your friends, please feel free to share. If there's anything you would like to hear about, please reach out to me. I have an email address, simplywomen'shealth2023@gmail.com. I can be found on either Facebook or Instagram at CJCEEJAYWHNP. That's it for today. This is CJ at your service.